All right, Wish TV medical reporter Dr. Mary Gillis joins us here on Midday to answer some questions about the coronavirus. And we're seeing a report now that a dog in North Carolina was infected with the coronavirus. We saw earlier, two cats in New York as well?
Right. So this was in the mainstream media. The first case in North Carolina, as we know, what we know of, there might be more, but a dog was infected with the coronavirus. 2 cats last week in New York. Okay? This is what we know. Maybe there's more. But the discussion here today isn't really about cats and dogs. What I really want to do is talk about research and the proper way to do research and sort of a timeline, brief timeline from what we know from the beginning of this.
Right.
So let's say first we were told this could not be transmitted from human to human.
Correct.
Then we were told this could not live on fabrics. Now it can. Then it was not in the air. Now it is. Masks were only necessary for healthcare workers. Now we see it's recommended for people to wear masks. And many in between, Mike. I don't know, there's others in between, right?
Right, right.
So this is the way scientific research works. And this is the ethical way, but it's confusing to the public because they are hearing so many mixed messages, just as we just talked about in terms of this and that and this and that.
Well, I mean, a couple of weeks ago, I didn't see anybody in a mask walking around or going to the grocery store.
Right.
Now everybody is wearing a mask.
And even the symptoms, maybe not yet anecdotal evidence, but it takes a long time to mount evidence because health officials want to come to a really good conclusion that this is actual factual based. You need many studies to determine whether this is true or not.
Right.
So I'm hoping that this can, gosh, what am I trying to say?
You're saying like ethical.
It's ethical, but it's confusing at the same time.
Right.
But ethical scientists work this way. And I don't know if you notice in the briefings, but they always say, this is happening, there's no evidence, because science lags behind. That's the way it works. That's the way it's always worked.
So let's get back to the cats and dogs thing here.
So
circle back there. So is that something that's going to start coming out now?
Well, Mike, we don't know. The question is, okay, now we don't. Well, first it was, oh no, don't worry. Okay, we don't know if it's transmitted from cats or dogs or to human. We don't know yet until we get the evidence.
Right.
We mount the evidence, and then we have a solid body of research, and then come out with a conclusion. Science lags behind.
Yeah, and we'll see if that's a case as well.
Yeah.
Dr. Mary Gillis, thank you so much for joining us. I appreciate it. We'll see you again tomorrow. Let's toss it out to Randy for a look at this soggy